I'm Dr. Blythe Adamson, Senior Quantitative Scientist at Flatiron Health.
And I'm Amy Davidoff, a Senior Research Scientist at Yale School of Public Health and the Yale Cancer Outcomes Public Policy and Effectiveness Research Center.
So, as co-investigators of this study, I think that our main finding was that Medicaid expansion was associated with reducing racial disparities in the timely treatment of advanced cancers. And this is some of the first evidence that we've ever seen that the Affordable Care Act and Medicaid expansion is really making an impact on racial disparities and in meeting one of its goals of improving equity. And what's one of your favorite parts about why the study is meaningful?
Well, we're focusing on timely treatment of initiation of cancer therapy for patients who have been diagnosed with an advanced or metastatic cancer. So these are patients who are walking into an oncologist's office with this diagnosis, and the first thing that the patient wants to know is what are the treatment options and which is the best for them going forward. Instead, what often happens is that they are engaged with the front desk asking what kind of insurance they have, and that information may in fact be part of that discussion, whether they can afford various treatment options. If they can't, if they don't have insurance, then there becomes a very lengthy delay in trying to get them insurance or other kinds of charity care or patient assistance that will allow them to move forward with treatment. We think that this is creating a disparity in timely treatment for patients. And that's why we looked at whether the Affordable Care Act with the insurance expansions, particularly for low-income adults, would have an impact on that process of care.
And Amy, in this study, we used electronic health record-derived data from across the United States to understand the experiences of cancer patients from 2011 all the way until February of 2019. And do you want to share some of the ways that we accounted for the way that practice is changing over time and the differences between states and the differences between patients even within a state?
Sure. This was what we call an observational study, in that it's not a randomized trial. We're not randomly assigning patients to expansion states or non-expansion states. Instead, we're just observing patients as their state policy changes and also as treatments change. So during this time period, for example, there was a dramatic increase in the sort of availability of an approval of and availability of various kinds of immunotherapy, which involved various kinds of genetic testing to identify the right targeted patients. And so we had to consider how these might also affect timely treatment initiation. In our analysis, we're able to control, because this is a regression analysis, control for not only other patient characteristics, the characteristics of their disease, the initial stage of diagnosis, whether this is a community or academic practice, but also we controlled for the average effects of the state that you live in, and also the time period during which you were diagnosed. So if you were diagnosed when there are new therapies for your cancer, we would be controlling for those trends over time.
Mm-hmm. Great. And I think for both of us, we're really looking forward to other researchers replicating these findings with other outcomes or and extending this work and evaluating national healthcare policies in this type of real-time policy evaluation.
Absolutely.
Thank you.
Thank you.